Welcome to our video on Asherman syndrome. Let's get started. And in this lecture, we'll discuss the definition of Asherman syndrome, as well as risk factors, clinical features, and how to diagnose and manage it. So let's start with definition. Asherman syndrome is characterized by formation of intrauterine synechia or adhesions as a result of damage to the endometrial lining of the uterus. And the two primary risk factors are intrauterine procedures, such as a dilation and curettage, and intrauterine inflammation, for example, due to pelvic inflammatory disease. And obviously, PID isn't necessarily associated with terminating pregnancy, but since we're dealing with Asherman syndrome, I want you to keep in mind that Asherman syndrome is not only caused by pregnancy termination, but it can be caused by an infection from PID. Okay, how does this present? Well, depending on the extent of intrauterine adhesions, Asherman syndrome may be asymptomatic, or it may present with the following clinical features. Women with extensive intrauterine adhesions may experience infertility or recurrent pregnancy loss. And women with mild to moderate amount of adhesions actually could present with dysmenorrhea and or cyclic pelvic pain, or they can be amenorrheic or have abnormal vaginal bleeding. So basically, it can make them infertile, it can cause a lot of miscarriages, or it can just mess with their menstrual cycle, causing pain with menstruation, no menstruation, or some other abnormal bleeding. Now, once suspected, the diagnosis of Asherman syndrome can be confirmed with a procedure known as hysteroscopy. And here's an image depicting the basic premise of a hysteroscopy. In this procedure, a clinician places a device called a hysteroscope into the vaginal canal in order to directly visualize the cervix and the uterine cavity. This image shows the view of the uterine cavity through the hysteroscope in a patient with Asherman syndrome. And the image on the left is a hysteroscopic view of the entrance of the cervix, whereas the image on the right is a view of the intrauterine cavity. Now, normally, everything should look healthy and pink in these areas, but in patients with Asherman syndrome, clinicians will observe lots of these white synechia or adhesions, and that can significantly disrupt the anatomy and the function of the endometrium. So how do you treat it? Well, it's actually pretty intuitive. You lyse those adhesions, and you do that manually. And thankfully for the patient, this can be done while it's being diagnosed. So under hysteroscopy, when you're visualizing the adhesions, they can surgically lyse them. So it's that simple. Now let's just wrap up with a simple question. How will patients with Asherman syndrome respond to a progesterone challenge test? Now, in order to answer this question, it's important to understand how a progesterone challenge test works. So the patient is given a dose of progesterone, and then they're monitored for subsequent vaginal bleeding. Healthy patients will report vaginal bleeding within about 2 weeks of the progesterone challenge test. And that's because in the setting of normal estrogen levels and a healthy endometrial lining, then the endometrial lining will grow in response to that progesterone, your challenge test, and then it will involute and slough off as soon as the progesterone runs out. So after that dose of the progesterone challenge is used up, then they'll bleed. And that's what you expect. But in patients with Asherman syndrome, they won't have any vaginal bleeding, and that's because of the intrauterine adhesions and significant damage to that endometrial lining. And that concludes this section.